Hello, my name is Rob Pennington. I'm at the University of Kentucky. I'm also a program support teacher in the area of moderate and severe disabilities for a large urban school district. Over the last 12 years of my life, I've been working with adults with mental retardation and autism and other, moderate and severe disabilities. And I've worked with them in educational settings, domestic settings, vocational settings, and all sorts of community settings as well. What I've learned from my experience is that these individuals are it's very fun working with these individuals, but at the same time, they bring a broad continuum of skills and challenges to my profession and working with those folks. First thing I like to do is when we talk about working with individuals with mental retardation, we like to discuss terminology. Historically, in the past, there's been a lot of terms that have been assigned to individuals with mental retardation that we now view outdated. There are also a lot of pejorative terms. If you walk into any middle school classroom, you're going to hear words like, that's retarded, and man, you're an idiot, all the time. So take 10 seconds and think about some of the terms that you've heard that have been used to describe individuals with mental retardation that may not be appropriate or updated, or may not seem updated at this time. Sure, you can probably think a lot of them. Some are a little more offensive, like short-bus kids, people that are retarded, people that are imbeciles. But then you can also pick out terms like cognitive impairments, developmentally delayed, challenged, special people. That maybe the intention wasn't to be negative. But what we like to do is when we talk about people with disabilities, use person-first language. A person with mental retardation, a person with autism, a person with a physical disability. These are used because it makes us talk. It makes us talk about the person first, where there's a person and they have a disability. So I think it's really important when you're using to use this terminology in the field. I'd also like to spend a little bit of time talking about some jargon that you may not be familiar with when receiving a student that may have come from a school setting. When we talk about mental retardation, the folks with mental retardation can have many labels. We talk about special education. A lot of times, large school districts will talk about high incidence versus low incidence disabilities. And what this means is the frequency or the incidence that these disabilities occur in the regular population. So low incidence disability are typically kids with more severe mental retardation, maybe autism and other disabilities, whereas high incidence disability is typically kids with learning disabilities, people with behavior disorders, or mild mental retardation. So you're going to hear a lot of times kids come in that he has a low incidence disability or a high incidence disability. There are other terms that are used within different school districts to talk about eligibility. So we're talking about some of these terms, especially in Kentucky, are functional mental disability. And these are for kids that have an IQ below 55, kids that have a little bit more severe level of mental retardation. You may also see individuals with mental retardation labeled as having multiple disabilities. That means in most school districts that these individuals qualify for services under 2 disabilities. So they may have autism, they may have mental retardation. They may have mental retardation and behavior disorders. You may also see individuals that will come from settings that are called MSD, moderate and severe disability settings, or MMD, mild mental disabilities. The AAMMR, the American Association on Mental Retardation, defines mental retardation as a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior as expressed in conceptual, social, and practical adaptive skills. And this disability originates before the age 18. Now this definition is the most current one, year 2002, but along with it, they hand us 5 assumptions. First is that limitations are considered within the context of community environments typical of the individual's peer age and culture. Now in the past, because the individuals with mental retardation show a sort of delay, a lot of times they have not been looked at as adults. In the past we've talked about things like mental age. So when we're looking at individuals with mental retardation, we want to make sure that an assessment looks at their ability to function and perform those skills and those activities that other people their age would be participating in. The second assumption is that a valid assessment considers cultural and linguistic diversity as well as differences in communication, sensory, motor, and behavioral factors. Last year there was a student in a public school setting that came from another country, performed very poorly on an IQ test, and then was placed into a classroom for individuals with mental retardation. It's shameful that sounds that happens often, and it's been reported several times, well, often across the country. If an individual has not been exposed to a certain concept, they're not going to do well on that item on an intelligence test. So we want to make sure that those tests are accurately measure what the students know, that they're not culturally biased. Also, some of our students have extreme difficulties in expressive communication. When taking a test where they're required to give a verbal response, it's going to be very challenging for them to perform well on those tests. We may not get an accurate measure of what they really know. Same thing with individuals that may have sensory or motor difficulties. They're going to have, if they are asked to manipulate blocks or make a pattern, we want to make sure it's not that sensory component that makes it difficult for them to perform correctly. Also, there are behavioral factors. Is this student performing because they don't know the answer or because they don't want to? Again, a lot of times some of our students that have some significant behavioral issues we may not get at the information, we might get a true accurate measure of their ability. Oh, excuse me. Okay. We also want the third assumption is that within the individual, limitations often coexist, and they do coexist with strengths. A lot of times when we are called into a situation, we're going to be working with a person, whether it's in a community setting, an educational setting, we are a lot of times drawn to the differences or the challenges that they have. And we want to make sure that any sort of valid assessment takes into consideration the things that individuals can do well. The fourth one is that the purpose of any assessment, or the purpose of describing limitations, is to develop a profile for needed supports. Again, the reason that we do an evaluation on an individual is to make sure that we are going to identify things that we can a baseline of performance that we can help them on. Okay, and finally, with appropriate personalized supports over a sustained period, the life function of a person with mental retardation will improve. And that's based on the assumption that we believe that individuals with mental retardation, with any disability, can learn. If we go way back in time historically, there was a time when that was arguable, and that was a debate, that why should we be educating or working with individuals with mental retardation because they are at a certain level, they have ceilinged out. And in the field, and research has shown us over and over again that that's just not the case. So any purpose of an assessment is to determine where those areas are that we need to focus and develop a baseline so we can show improvement. Again, we're making that assumption that there are skills that our individual can learn. Okay, when we talk about mental retardation, there are three parts of that definition. One is significant limited intellectual functioning. So what we're looking at are ranges on intelligence tests, ranges of scores on intelligence tests. Typically, mild retardation is from 50 to 55 or 70 to 75. Moderate retardation, 35 to 40 to 50 to 55. And severe retardation, 20 to 25, 35 to 40, and then individuals with profound retardation is below 20 to 25. Okay, one of my slides is not coming up, but what we're going to talk about is how that's defined is if we look at a normal curve of all the individual scores, there's a majority, 68% of society that have people that have taken the test are going to score in a certain range. We consider that the average range, and that is 85 to 115. When we go 2 standard deviations below that, we're looking at 70 to 75 and below, and that's the range of mental retardation. And as we go further and further down, from 70 to 55, another standard deviation of 15, and progressively downward. Okay, but there are some considerations when looking at IQ scores. First of all, the concept of intelligence is a hypothetical construct. For example, we may know some that may not perform well on an IQ test, but they may have great strengths. You look at the different things that we look in society and how we value intelligence. We have individuals that are doctors that people consider very intelligent. But if I look at somebody that can fix my car, that person's a genius too. So what Just intelligence is just a construct. Second, intelligence tests only measure how a person performs at one point in time. As we talked a little bit before, we're not sure. Maybe that student was having a bad day. Maybe that individual, didn't have breakfast that morning. So we're only able to measure them at one point in time. Another thing that's very important to realize is that IQ scores can change. Again, whether it's based on a person maybe having a bad day when they took the test, or if they have significant deficits in communication and then they make vast gains in those communication skills, they can perform very different on an IQ test at different times. We talked about earlier, intelligence tests can be culturally biased. Again, they can present information that an individual has had no experience with. Intelligence testing should never be used alone to make decisions about the provision of services, and that's key. When we're looking, and we'll talk a little bit later on the presentation about this, but we really want to look at environments. We want to look at sets of skills, look at progress where individuals are, and then move forward from there. IQ scores just kind of give us a guide, a place to start looking. Okay. Goals should not be developed from items on intelligence tests. Again, a lot of the items on intelligence tests are like putting blocks in order. We want to look at things that we're going to work on that are immediately functional and relevant in a person's life. And often intelligence tests are normed on persons without disabilities. So oftentimes there's lots of questions about their validity as well for assessing individuals with mental retardation. The next part of that definition of mental retardation is that there is a deficit in adaptive skills. Adaptive skills are a collection of conceptual, social, and practical skills that have been learned by people in order to function in their everyday lives. There are so many things. I use this example all the time, or I'm perplexed by all the millions of things that we learn without being explicitly taught. And we go through our lives by watching other people's failures and trials, and we realize, hey, that's not something I should do because I watched the response that somebody else got for performing that behavior. But a lot of times individuals with mental retardation may not do a very good job at learning from watching other people. So there's a whole set of skills that need to be taught that they just that they may not automatically get or learn. Nobody ever sat down and taught me exactly how to use a fork. I mean, I watched somebody else do it and I picked up and that's what I did. No one taught me how to go on a date, but I watched television, I watched experiences of peers in the neighborhood, and that's how I figured that out on my own. Again, there's probably some crash and burn experiences, but I was able to learn from those experiences. When we're looking at adaptive behavior in terms of assessment, we're typically looking at the use of behavior rating scales. These are scales where a lot of times, individuals, there'll be a catalog of skills, and then there'll be a rating on how well they perform these skills. Now, what do you think are some of the difficulties with using rating scales? Well, often, first of all, they're filled out by parents. And though we value the opinion of parents, and definitely they typically know most about the individuals that they live with, sometimes they may have a skewed view of an individual's performance. Often they may be filled out by one professional. They may say that maybe a job coach is asked to fill it out, or somebody in a school setting is asked to fill it out, but they haven't seen the wide range of performance and environments that this student has been able to perform in. So, for instance, this individual may have a terrible time in a school setting during lunch, but when they're using specific materials in a home setting, they're fine. So again, when one person is filling out these rating scales, and often it is an assessment may be based on a report of one person, not always the best practice, but they may be operating from very limited information about that individual. A newer way to think about the classification of individuals with mental retardation is to classify them by levels of support needed. The American Council on Mental Retardation has introduced this idea in the 2000s, and are making a push that that's how we should look at it. And as a practitioner, it makes a lot more sense. I don't know what I can't always say what an IQ of 57 or 43 means to me when I'm trying to develop an intervention for someone. But if I look at a level of support an individual might need, it may give me a little more information about what this student may need, or what types of planning I need to perform for this student. For instance, they talk about levels of support as intermittent, An intermittent support might be a support that's episodic in nature. Maybe if you're working with the individual on a job site, they do a great job, but every time a new facet of that job is introduced, they need some additional training at that point. That might be intermittent. Limited, maybe an individual in a community setting that needs somebody to come out and check on them once a week, make sure things are going smooth, solve problems. The next level would be extensive. And extensive might be somebody that will need somebody on a daily basis, going in and checking and there need to be supports in place. And then the next level will be pervasive. And these individuals, typically individuals with more severe mental retardation, will need layered levels of support every day at intensive levels. For instance, you may need an individual that needs constant supervision while they're out in the community, needs multiple levels of supports within their instructional tasks, and needs constant reinforcement. So what I'd like to do is take a few minutes and talk about the characteristics of individuals with mental retardation. I'm going to share you a little bit give you some information from the literature, but also share with you some of my experiences. Individuals with mental retardation, typically there's a delay in cognitive functioning. First of all, individuals, and when we talk about cognitive functioning, we're talking about delays in memory. And how would delays in memory affect an individual with mental retardation? It's going to make it very difficult for them to establish routines often. They're going to have a hard time remembering experiences that they have had in combination with events. So for instance, I know that if a fire alarm goes off in a school building, I've had that experience before, so I'm not going to be overwhelmed. I may say, you know what, I remember I would go outside. If an individual with mental retardation, with retardation, when you have problems with memory, you're going to have a hard time remembering that there is a repertoire of events that can happen in response to a certain stimuli. Also, when you give directions to an individual, especially on a job site or in a community setting, a lot of times we find ourselves going back and saying, didn't I tell you this over and over again? But a lot of times our individuals with mental retardation may not remember that information. I was actually in a setting that 2 days ago where a therapist was working with a young woman with mental retardation, and they were working on a job task. And she asked her to initiate the task sequence, and the individual just kind of paused. Well, instead of helping her or giving her the appropriate prompts, she kept verbally asking her over and over again, now you remember what you're supposed to do? Now where do you put this item? And so what, in effect, she was increasing the student's anxiety, and then the student started acting out and having some aggressive behaviors because she just didn't remember. The information wasn't there anymore. But this person thought that if they kept giving her cues that she would remember it. Another thing that's really, really important to consider when working with adults with mental retardation is that there's a slower learning rate, that there is a longer acquisition of skills, which means the individuals typically need more trials to acquisition of a skill. How many times do we go out like once a week or in a very infrequent manner and say, okay, this is what you need to do? Well, a lot of the individuals that we work with mental retardation may take years to learn a skill and need constant reminder every single time, this is what you need to do. And then a systematic level of prompts is faded. Often, one of the challenges that we have in community settings where there's a lot more variability in events that are happening is that we are trying to give this individual the appropriate information that they need to complete a task, even though the task is changing slightly, and then it may only happen a couple times a week. Well, a lot of our students, again, or a lot of the individuals that we work with, need constant, repetitive training on a skill. Something else that's really important to recognize is that individuals with mental retardation often have a hard time generalizing skills from one setting to another. We make a lot of assumptions about it. If you can do this skill in one area, then you should be able to do it in another area, and that's really not the case. Case in point, for a couple of years I taught middle school, and I would work with kids in using money handling skills, and we would train it every day, and these kids were really good. They would be able to read a price tag, pull out the correct amount of money. We'd do something called the next dollar strategy, whereas if it's $2.35, they would pull out and give $3, so they didn't have to count change. And then what would happen? I'd take them to community setting, totally different setting, a different person working with them, a cashier saying, okay, here's your change. and they wouldn't be able to perform the skill. There's a lot of things that really changed the environment as well. For instance, 2 summers ago, I worked with a young man with Down syndrome. We went out in the community, and a part of our community tasks is after we worked, we'd stop by Qdoba and get something to eat, which is a local Mexican restaurant. And what I noticed is that I had trained him to use that same next dollar strategy, and I said, you know, I realized that a lot of times people will say things different ways. So they may say it's $2.35, or that's $2.35, or they may even add additional information like, hey, thanks, that's $4.60. Well, hearing that in different ways, we can't always assume that the individual with mental retardation is going to be able to pick up or be able to generalize $2.50 to that different way that's spoken. So I said, you know what, this is how I'll help you. What I'll do is train you to look at the price that comes up on the cash register. Well, that worked for Qdoba, but then when we went to a Blockbuster to rent a video, the cash register looked totally different. And so you have to realize that within a community, the stimuli that we're teaching our kids to attend to and perform skills in response to are constantly changing, and that's a big challenge. Something else that's very important is to consider is motivation. A lot of our students, because they've experienced failure so many times, they have what's called learned helplessness, or because they've been given so much prompt and those prompts were systematically faded that they can't perform the skills without those prompts. There's a young man that I know that is 23 years old and has a mental retardation, and he goes into a community setting on a regular basis. And well, let me start back. He was able to graduate from his high school setting with a diploma. He had a lot of support and a one-on-one teacher assistant that helped him get through. We got him graduated, and then he went to work in a community setting. He got a job. Well, what happened then is that teacher assistant wasn't with him anymore, so he could not organize. He lost his first 4 jobs within several months. Now, currently he is working, but he requires intensive supports. Even though this individual appeared to have enough cognitive skills to be able to perform some basic academics and graduate from school. So it's very important. You know, I actually was talking to this guy's father 2 weeks ago, and he lost his paycheck walking home from work. Again, and that goes back to some of those adaptive skills. Some of our kids just do not have those organizational skills, and those are done for them in other settings. So again, that's kind of a learned helplessness, maybe a combination of prompt dependency. Well, also, another characteristic are some challenges with adaptive behavior. You know, first we want to look at self-care and daily living skills. We have to address toileting. Some of our individuals, there are things that we assume are taken for granted, that we assume that people learn, but they don't learn. You know, another great example is a lot of individuals with mental retardation, when they go into a urinal, they will drop their pants all the way to their knees. You know, and in the society, in a men's bathroom, when you walk into that, you know, some people find that very offensive. But where is that taught? In an educational setting, there's not many teachers, especially when you're working with males and you have female teachers, that are going to spend time teaching that skill. So there's some toileting issues. Even though somebody can be independently, there may be some things that need to be taught that across all levels of mental retardation. We're talking about hygiene. And again, there are all sorts of issues associated with hygiene. Medical needs. Not only can an individual access, you know, whether they're taking medication, be able to do some of the things independently. Again, if you have somebody that's on medication and we're talking about some of those memory issues, they're going to have a hard time remembering. So they're going to need some supports to make sure they take that medication. But what happens, where are kids with mental retardation or individuals taught to put a Band-Aid on or to do first aid if they fall down? So those are some issues that come into place as well. Making healthy food choices, and this is a big concern. Left to their own devices, a lot of folks with mental retardation will eat what they think is good, which is typically a lot of things high in sugar and carbohydrates. Shopping and cooking, being able to independently cook and go to a grocery store. I have a friend that's 42 years old and has mental retardation. I met him. I actually teach martial arts as well, and he came into my school, and we've been friends for about 6 years now. He has recently gone through a divorce and now is living on his own. He has no idea how to shop. He doesn't know how to use money, but this is an individual, I'll probably talk about him a little more later, but who was able to do a 40-hour-a-week job, driving trucks, doing loading and unloading, but yet when it came to some of those basic skills, being able to go to a store and buy something to eat, he could not do it. And he can't even cook. He can make sandwiches himself. So again, looking across the range of mental retardation, there are all sorts of skills that we need to address. Okay, that we need to address, excuse me.